this is one of the sites they'll be using tomorrow for so-called surge testing, in other words, additional community testing, trying to track down any possible new cases of this variant. So they're asking people from 5 postcode areas in South Gloucestershire to come forward for testing. The focus is on this area because 2 of the 3 cases identified in England originate in South Gloucestershire, 2 from the same household, one of whom is understood to have travelled back from Brazil in the middle of February. That was before the new hotel quarantine arrangements came in, but we understand they were quarantining at home. There's been a lot of talk about new variants. This is the so-called P1 variant. It shares some similarities with the variant first identified in South Africa. It's the P1 first detected in the city of Manaus in Brazil. And Public Health England is saying that it's too early at this stage to say how this variant will respond to vaccines.
This P1 variant is more transmissible than the original strains we saw from this virus. It is likely to have more antigenic change and therefore increase the risk of reinfections. And while we don't know the response to vaccine yet, we are concerned that we don't have spread of this that may impact on our vaccine programme.
Now, Andy, what about this 3rd case in England whose identity and whereabouts are unknown?
They're still trying to identify this person. The problem appears to be that it might have been someone who failed to complete all the forms, all the details on their registration card after they went for a test. So, in effect, they've been able to do the genomic sequencing of the infection, but not marry that infection to the person who first had it. So it could have been a home test, for instance, where all the details weren't filled in. So what they're now doing is asking for anyone who had a test on the 12th or 13th of February and might not have filled in all the form or might not have got the result back from that test to contact Public Health England or call 119. The uncertainty around this case, the uncertainty around the variant in general, perhaps explaining why they called a press briefing and why they issued press releases at such short notice this afternoon.